How the Hincks-Dellcrest Center will serve you better. Mental health is a complex issue, especially for children and youth. Many young people in our community need support, but each one of them is different. Meet Mihail. Mihail is very anxious. His parents have been placed on long waiting lists and have consulted with several hospitals and agencies. But Mihail is not feeling any better. There are so many options for Mihail, but his family is confused about what is the best for him right now. This is Sarah. Sarah has been clinically treated for her obsessive-compulsive symptoms. However, now, Sarah is showing symptoms of depression, and her younger sibling, Chris, is beginning to struggle with gender identity issues. Could Sarah's family take steps to provide Chris with support at this stage? Here's Sunita. Sunita is ready to return home after 6 months of inpatient residential treatment. However, her family is concerned about her aftercare options. Older clinical models didn't always have the answers for Mihail, Sarah, Chris, and Sunita. The Hincks-Dellcrest Center will offer clearer and more integrated pathways to personalized care. Our new clinical model will improve access to the right care from the right provider at the right time and decrease the risk of acute recurrence, as well as risks to siblings and families. What we know is that every child is different and that the best care is personalized care. Mihail, Sarah, Chris, and Sunita may need clinical treatment, prevention, early intervention, or community-based care. Instead of just waiting or being confused by too many options, our assessment and intervention services will provide children and families with support and access to the right treatment. Mihail and his family will be linked to the right services, and we will build in supportive services for his family while he receives his treatment. In addition, our new model is well integrated so that children can access different services as their needs change. Sarah has secondary symptoms, and Sunita is moving back home. The new clinical model will connect Sarah with appropriate specialists instead of sending her back to the bottom of a waiting list, and will provide assessment and care for Chris. Sunita will be connected with in-home step-down services and community-based support after being discharged, and her family will receive holistic assistance to help Sunita reintegrate into the home and community. Finally, our new model focuses on outcomes so that children and families can receive optimized services, no more or no less than is needed. Mihail, Sarah, Chris, and Sunita's conditions will be assessed and monitored by our staff in order to make evidence-based decisions about their care. This will be supported by innovation and technology that supports communication between our staff and children and their families, as well as with other care providers. As a University of Toronto teaching affiliate, we will also build system capacity for the future by training clinicians to support the children and families we serve. We believe that more children and families with mental health needs can be served better under our new clinical model.